Why do you think literacy hubs, such as the library or digital health literacy hubs, are such a vital place of trust for people who feel nervous or overwhelmed about using digital tools like the NHS app?
I think, the vital bit is the fact that we're trusted, and the fact that if people feel insecure, going straight to technology isn't the thing that's going to make them feel more confident necessarily. Like, they have to have someone with them who can break down those barriers, and that's what we're here to do.
So I meet people in the library who feel completely distanced from this digital world we're in right now.
I think the biggest risks for people that aren't digitally confident when moving all the patient feedback onto the NHS app for health services is that they won't be heard at all.
Maggie's story. The biggest fear from April 2026 is losing your health because you cannot navigate the NHS app online. Maggie sits in her garden in the Meadows, gazing at a hospital letter she's read 3 times already. The letter says her blood pressure readings should be submitted via the NHS app. She feels that familiar knot in her stomach again. It's the next day. She stares at the text message on her phone with the NHS app link to submit her blood pressure readings. She's worried that one wrong click will delete her from the doctor's list forever. She's tired of calling her daughter in West Bridgford for help. She dreams of watching her grandchildren grow up without her help becoming a full-time job of phone queues and paper logs. She's part of a growing community in Nottingham. Maggie's hesitation isn't just her, it's a reflection of our city. Here in Nottingham, many of us still feel like we're standing on the edge of a digital divide, especially when it comes to our health. The statistics tell the story. 77% of those at risk of being left behind the technology are over 65. The UK is shifting. We're entering the time of apps on prescription. From April 2026 and by the end of 2029, 95% of NHS hospital appointments will be handled right here in the palm of your hand. From April, your doctor might prescribe a digital tool for you to use at home to stay well, right alongside your usual tablets. Maggie's biggest hurdle is the fear of the technology. But here's what I told her. Your medical records are locked behind the same level of security as a bank. Before we look at those new prescribable apps, we need to get Maggie through the front door. Maggie is taking the first step. Are you ready to join her? She's lived in Nottingham for 40 years. As the world shifts from digital-first services, her self-perception has shifted from a capable community member to someone who feels left behind and forgotten. She spends a significant portion of her Tuesday and Thursday morning trying to get through to her GP surgery by phone, often waiting in a 40-minute queue only to be told to use the NHS app. For the thousands of residents in Nottingham, like Maggie, this isn't just about a phone. It's about making sure the digital default doesn't mean being deleted from the system. Once Maggie saw that green tick, she realized she was in control. She wasn't a burden to her children anymore. She was a patient with a plan. Now that we're in, let's look at Maggie's journey from tech anxiety to health independence. It's Tuesday morning in the Meadows. Usually, Maggie would be on her 3rd attempt to call her GP surgery, stuck in a phone queue behind 40 other people, just to ask for her regular blood pressure tablets. But today, she's bypassing those Nottingham phone lines entirely. She opens the prescription tab. There they are, the same medicine she's taken for years. With 2 taps, her request is sent directly to her GP. No holding the line, no explaining herself to a receptionist at the surgery, and no walking down to drop off a paper slip in the rain. The app even remembers her favorite local chemist, whether she wants to pick them up at the booths in the Victoria Centre while she's shopping, or have them ready at our local independent pharmacy. She's the one in charge. While everyone is still waiting on hold, she's heading out to her garden. Just as your doctor might prescribe you a pink pill or a white tablet, they are now going to be able to prescribe you a digital tool. If Maggie struggles with her blood pressure, her GP can send a specialist app directly to our NHS App account. These are NICE approved, meaning they've passed the highest safety checks in the country. The best part, if Maggie's blood pressure spikes while she's at home, our clinical team in Nottingham can see it in real time. For Maggie, this means fewer unnecessary trips to the QMC or city hospital. Our care is moving into our home, making her kitchen in the Meadows the most advanced healthcare center she's ever known. I know this feels like a lot to remember. That's why I've given Maggie a simple daily routine to stay in control. We call it Care Check. Coming up in part 2, C.A.R.E. We're heading to the heart of the city. The Nottingham Central Library has officially opened its doors as a digital support hub, helping locals master the NHS app. For more insights on the UK's digital health inclusion and transition, subscribe, follow, join our community. Tag a friend in Nottingham who needs the support. Turn on your notifications for live updates and more tips. Stay tuned.